For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning and welcome to Live with the County of Santa Clara. My name is David Campos. I'm a Deputy County Executive and I'm also serving as co-lead Public Information Officer for the Emergency Operations Center for the county. We are here today with James Williams, who is the County Counsel for the County of Santa Clara. But before we begin our discussion, I want to provide first an update of COVID-19 cases in the county. We have 2,179 cases of infections that have been reported and 113 deaths. And again, our hearts go out to the families of those who have passed. I also want to note that today is May 1st. In many parts of the world, they celebrate workers. And today we want to send a big shout out to all of the essential workers of the County of Santa Clara who are out there keeping things going in the county. So thank you for what you do. And then before I begin, I want to note that I'm wearing my pin, my census pin. And the reason that I have this is that even though we're going through this crisis, we're still trying to complete the census. Santa Clara County right now has the highest response rate of any county in the state of California. We want to keep it that way, and those of you who haven't responded to the census, please make sure you do so. So I'm here with James Williams. James, you're the county counsel. You run the legal department and the affairs of the county, and one of the things that you do is to represent the health officer, and in this case, put the thoughts and the guidance of the health officer into a document, which is this revised order that went out. And so, as the person who helped draft that, what do you want people to know about this revised order?
Sure. Well, thank you, David. As an attorney, we can often get kind of caught up in details and technicalities, but one of my first principles as a lawyer is to first try to apply as much as possible common sense and judgment. And I think that's really true when you think about what's going on here. Why do we have a shelter-in-place order? We have it because this is the tool that we have available to deal with the spread of COVID-19, given that there isn't widespread immunity, given that there isn't a vaccine, and given that there isn't a pharmaceutical treatment. And so if you think about that first basic principle about shelter-in-place, I think it answers a lot of the more detailed questions, which is that really as much as possible, folks should be trying to minimize contacts with others. And when you have to have contacts and when you have to go out and about, as we all do need to do for things like to obtain groceries or to obtain other things, that we do so maintaining social distancing, maintaining good hygiene, maintaining good practices to minimize the spread. So if you start with that first principle, I think a lot of the rest comes together. So we do have a new order. It takes effect on Monday. It extends through May 31st, and it largely continues the same framework that we have, although there are a few modifications.
One thing that I forgot to mention that I want to note is that we actually were using face coverings before we started this Facebook Live, but we, of course, to conduct the Facebook Live to make sure that the American Sign Language interpreter could interpret, we're not wearing them right now. In terms of the big changes in the order, what are the highlights for folks who are wondering what is different today? Yeah,
this order does begin some gradual easing of the shelter-in-place, and the two major areas for that are construction, so all construction activities allowed to resume, and outdoor businesses. And those areas were chosen by the health officers with respect to construction because there's very detailed, careful safety protocols that are outlined, one set for large construction projects and another set for small construction projects. That industry is used to having adherence to very strict and significant safety standards. Also, many of those activities occur outdoors. With respect to outdoor businesses, it is believed that there is less risk in that context without having air circulating kind of a closed environment. And so that is the place to begin some easing. Gradually, they are closely going to monitor indicators. So one of the announcements was that there will be 5 indicators that they'll be looking at and closely tracking as things progress. But those are the 2 main categories that are opening up on Monday.
And my understanding is that even if they're allowed to operate, they have to follow certain protocols. And of course,
Yes.
social distancing is still a requirement.
Yeah, so social distancing requirements remain, and that's been true for some time, even for essential businesses. And the basic principles are to maintain at least 6 feet between persons, to use face coverings, to have outstanding hand hygiene and cleanliness. Those are kind of the core principles, but each business that is open does have to have a protocol that they post outlining how they are implementing these critical best practices.
We will be spending some time in the near future speaking about some of those protocols and some of the tips, for making sure that these workers are safe. But I want to ask you about a couple of key questions that we have been receiving in the last couple of days. And one of them, tennis. Can you talk about tennis? Is that allowed? How does that work?
Yeah, so there is some opening up of outdoor recreational activities. We all know the weather is gorgeous, and this is a beautiful time of year. Outdoor tennis courts will be opened, but only for play with folks in your household or living unit. And I know another question has come up related to golf. And one of the challenges a little bit has been the interaction between the local orders and the state order, and whichever is stricter controls. Fortunately, yesterday the state put out some more detailed guidance on outdoor activities, and golf is on that list, and golf is allowed under the new local order. So beginning Monday, singles golf is the guidance from the state, will be allowed.
So you said Monday. So the new order goes into effect when exactly, James?
On Monday, May 4th, and runs through May 31st.
So looking ahead for the weekend, for this weekend, for the remainder of the weekend until Monday, the existing order remains?
That is correct. So through this weekend, the existing order does remain. It was important to make sure that there's a little time, in part so that facilities can actually have these social distancing protocols in place and rigorously adopted. That's why there needed to be some time to stand that up.
Another question that's come up is childcare and recreation for kids. Can you talk about those?
Sure. So under the state order as well as the local orders, child care programs are available for those workers who are working in essential work, under local or essential businesses, essential governmental functions, and the like. The language was clarified to say that does include summer programs and educational and recreational programs for those children. And there's some important criteria, and one of the most important of which is that it has to be with a stable group of no more than 12 children. And that's really important because there's still a lot that is being learned about the extent to which children can be vectors for the spread. And so keeping that stable group of 12 ensures that if there is a COVID infection, that it's not spreading to many, many, many cascading sets of families. It's something that can actually be contained. And so that's one of the very critical key factors with child care and summer programs.
Now, one thing that I think often perhaps people don't focus enough on is the idea that even though there is some easing, that there's still the general rule is you shelter in place. So can you talk a little bit about that?
Yeah, we're really trying to learn the lessons from history. And if you look at the 1918 pandemic, which is I think the closest analogy that we have to this unprecedented situation, when people kind of declared victory prematurely and said, well, we only need face coverings and nothing else, and this even happened in San Francisco in 1918, there was a huge second spike of cases, and that a huge number of fatalities and other illnesses. The other thing that we're learning as the science is getting better and better about what this disease does is that there are a lot of other risks that we're learning about, including to younger folks who otherwise seem healthy. And so it's really important that we remain true to the basic principles, as I mentioned at the beginning, and that is that we are still in a mode of shelter in place. It's difficult for all of our families. It's difficult for my kids and my family too. But this is the tool that we have, and it's been extraordinarily successful. And we don't want to lose that progress that we made through our collective extraordinary sacrifices. And so that's the goal. Together we can achieve it, and together we will continue to be able to move forward. This community is so resilient, so outstanding. We have great leadership from Dr. Cody and our public health officer, but we also have absolute leadership, really, from the daily actions that people take, the choices that all of us make to exercise good judgment and follow the guidance that we're getting.
One final question that I have, you talked about the indicators, and in a way they provide a roadmap for moving forward. Just briefly, how does that work? Is there one that's more important than another? How is that analyzed? And I know that we're going to provide information going forward about each one of them in our progress, but how does that work?
Yeah, it's a totality, right? Each of these things represents something that's important that the health officers in the Bay Area believed was a critical metric to look at. But there are other things too, so it's also not an exclusive set of things. Like I mentioned, the science continues to evolve. But these are some core things that we know we need. We know that our healthcare workers and other first responders need PPE. We know that we need to keep careful track of hospitalizations. We know that we need robust testing. We know that we need robust case and contact investigation. These are kind of core touchstone factors that together we need to have in place in order to keep everyone safe.
James, thank you very much for joining us today, and there's a lot more information on our website about the order. There's FAQs that answer many of the questions that people are asking. We also have information in multiple languages, and feel free to contact us. We have a team of people in the Public Information Office that are ready to respond to your questions. Santa Clara County, thank you for your sacrifice, for all we are collectively doing. Stay safe out there, and thank you very much for joining us.
Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.